organization with great amount of passion, and along with a phenomenal team of dedicated professionals who have brought us to where we are. And now we are at a point of pushing the boundary and able to deliver healthcare of the highest quality to more and more people. And we would like to think Sparsh always wants to be at the cutting edge of medical science and to be able to do to our own people in this part of the world the best what is possible in the world. So we like to believe that we can deliver that healthcare with an extraordinary set of professionals working with us. And in that direction, today is yet another milestone. Cancer has been the bane of humanity for a very long time. And I keep saying, when we were students long back, we used to read so much about how to diagnose cancer and pages of how it presents and all of that. When it comes to the treatment, it used to be only one paragraph. Nothing much was possible. Today, so much is possible. We have so many wonderful people who are leading a great life after conquering cancer, and they have contributed immensely. For the second innings they play it even better than the first innings, because they really start appreciating the value of life, and what they do is extraordinary. We as medical professionals playing a part in this journey gives the greatest satisfaction, and this is why we spent all our years studying and wanting to be good at our job, is to make this a vital difference in people's life. And BMT is such an extraordinary speciality where we are able to give hope to people who didn't have any hope. Sparsh is committed to do this, and I'm very proud that today we have Chandrakala coming. She used to be heading the KEM at Mumbai, and she has joined us leading the team at this unit, along with our own extremely well-rehearsed team, which has been doing huge amount of work at Yeshwanthpur. It's one of the best teams around, and the number of complex cases, the number of people they have touched is extraordinary, and they will be part of this whole thing. And we are expanding and growing by the day, and trying to touch many more lives. Mahesh, who leads the team at Yeshwanthpur, along with Sunil and Anand, and I think Smita has joined us as the next person joining this team. It's all them who really do the difference. Our job is to give them a platform, and they do what there is needed to be done. Just one last thing is, this unit is our first comprehensive unit for cancer care. We do everything there is to do in cancer. In fact, soon we'll be inaugurating one more most advanced part of cancer care, which is called the Therapeutics, which is also going to come into existence through this unit. This infrastructure is built for that. Today I want to also announce that we are doing more Sparsh Institute of Cancer Care in our other units, which are spread across the town. Our RR Nagar unit is going to get the complete comprehensive cancer care. So is our Sarjapur Road unit, and more in the pipeline. We want people to travel less and get the same expertise everywhere. We are trying to geo-map the city of Bangalore and be there for everybody to give the best possible cancer care. And it is an extraordinary grace for us that the name which is identified with cancer care, not just in Bangalore, across our country. Dr. Shekhar Patil is our biggest well-wisher. He's our director, and he is an epitome of ethical practice, because cancer is such an area where people will do anything to save their lives. And what's very important is how ethically we practice this medicine, how empathetically we practice this medicine, and how we can make this extraordinary possibilities available for most people at an appropriate cost, and the way it has to be done, so that they're put through least amount of difficulty. And there's no better human being. There's no better mascot for Sparsh than Dr. Shekhar Patil. We are very, very blessed to have his guidance, his directions, in which we are doing everything we do in cancer care. And that's the biggest gain for Sparsh Hospital in the last few years of his association with us. And that's all I have to say. And I wish the entire team the very best of luck. Believes in this, and I have the confidence they have the same heart to serve the people. And I can say it with that confidence that we will be able to deliver the best possible without compromise to most people who come through our doors.
The cancer itself, the incidence of the cancer in India is increasing, and almost we are going in pace with the Western world. This is mainly, I feel it is because of the our life expectancy has increased. It is a disease of elderly people. The cancer, majority of the diseases of the elderly people. Because of that one, our life expectancy, which was 40, 50, now we are in 70s. So the incidence is increasing. I think 50%. It is projected that around 500% increase in the incidence of cancer because of the age, the life expectancy being increased. And second is, it is a lifestyle disease because of our habits, the type of food we eat. We are becoming more and more westernized. So because of that one, the incidence is also increasing. So what I feel is the infrastructure and the number of doctors treating this disease is definitely much, much less than what we require at this point of time. So that is how, when I came with Dr. Sharan, he was having general comprehensive general hospital. I requested him that no, you should have one oncology wing for every hospital. So you have it, because because of the number of patients are increasing. People have to travel very, very long distance to get that care. So that is how it started, and I can only say that we have got one of the best comprehensive setup. All the infrastructure, radiation oncology unit, medical oncology unit. What was deficient was the bone marrow transplant unit, and everything, and the nuclear medicine, theranostics, palliative care, almost, and verticals, particularly the subspecialties in oncology itself, like orthopedics oncology, thoracic oncology. We have got specialists for each cancers. So the type of care the patients are going to get will be really, really great, basically because of the expertise what we are going to have it. So what I feel is, now with the BMT coming in, at least 15-20% of our cancer patients at some point of their treatment requires the transplant treatment, maybe in the form of an autologous transplant or in the form of allogenic transplant. Now we are getting the CAR T cell therapies, which is also coming up in a big way. And definitely Dr. Mahesh and their team here are going to come up with a CAR T cell therapy here at this center. So it is going to be a great time for the treatment of cancer, and ultimately what is going to happen is our outcomes will improve. The cancer treatment outcomes, what we used to say, incurable disease, now at least 40-50% of the cancer patients can be totally cured with today's advances in the treatment which is occurring. So I feel we are definitely in a better position, and at Sparsh, we have developed almost everything, whatever is required for an ideal cancer hospital should be there. We have got all the facilities for getting it, and all the subspecialties are at place. And in coming days, we are going to get into the molecular biology. The diagnostic also is another area where we are not started. So that is another area we are going to get in. So we have got an extremely good pathology. Almost all departments are extremely good. So ultimately what we are looking at it is, any patient walks here should get the best cancer treatment as it is there anywhere in the world. So that is what is our aim.
Obviously, oncology is evolving, and for us, access is a big thing. And all our hospitals are located in such a way that the micro markets, the larger population can access our hospitals much easily. And hence it made all the logical sense to have a very important specialty like oncology here. And with the launch of BMT, the entire scope of services within that specialty is now complete within this hospital, which makes the hospital also responsible for ensuring treatment which is transparent and also full of empathy, because oncology needs long-term hand-holding and within clinicians and the support staff. Very proud to ensure that we've got everybody in place who will deliver this care. And also very happy and thankful to the patients who've undergone treatment under this team to be here, and also as a testament the fact that the clinician team that we have here is world class.
So we still lack a lot of patients die of disease. That is the need at present we have in our country. So in our Spurs Institute of Cancer Care, we are immensely proud to start this bone marrow transplant unit. So bone marrow transplant unit stands forefront in the modern cancer and the blood disorders management, because it is the only life-saving treatment for the patients who don't have any other options of management. So in Spurs Institute of Cancer Care, we are the bone marrow transplant is mainly used for the cure of thalassemia major patients, sickle cell anemia, aplastic anemia, and some immunodeficiency disorders. And it's also a treatment for cancers like acute leukemia, lymphoma, and multiple myeloma. So the patients can get a second chance to live. So in our institute, we have 7-bedded HEPA-filtered positive pressure controlled rooms, which is especially designed to control the infection in our patients because they are immunocompromised patients. So along with this positive pressure control rooms, we have an advanced monitoring system, we have a transplant ICUs, and we have round-the-clock lab services to help the patient to have a safe and successful transplant. And to lead this transplant, we need a good team. So in our institute, we have a 5-member team of hematologists, both adult and pediatric hematologists we have, who have expertise in doing the bone marrow transplant, and they have trained across the world, and they'll be doing the transplant. So thus the transplant physicians is not enough to do the transplant. We have internists, we have transfusion medicine experts, we have lab scientists, and the pillar of the transplant is transplant nurses. So we have the best nurses who will do the transplant in our center. So together as a multidisciplinary team, we can serve the patient from diagnosis to the donor selection and the transplant. And along with the transplant, the patients require long-term care. So as a team, we are going to do the long-term care for these patients.
First thing was, I had promised her when she started with the disease that it was an immensely curable disease. Without transplant, even with just oral medicines, you can survive for many years. And unfortunately, she progressed into an aggressive phase of the disease, and that is when we decided that we need to salvage her with the transplant. And we did a mass sibling allotransplant. Now she is here in front of us without any medicines, almost like 7 to 8 years now, without any complications. She continues to do all her activities with the same vigor as what she used to do before she got the transplant. I would welcome Gayatri to share a few words, maybe for a minute.
2019 ಬ್ಲಾಸ್ಟ್ ಆಯಿತು, ಬ್ಲಾಸ್ಟ್ ಕ್ರೈಸಿಸ್ ಅಂದ್ಬಿಟ್ಟು 2019 ನನಗೆ ಬೋನ್ ಮ್ಯಾರೋ ಮಾಡಿದ್ದಾರೆ. ಆವಾಗಿಂದ ನಾನು ತುಂಬ ಖುಷಿಯಾಗಿ ಲೀಡ್ ಮಾಡ್ತಾಯಿದ್ದೀನಿ. ನೋ ಪ್ರಾಬ್ಲಮ್. ಮೊದಲು ಹೇಗಿದ್ದೀನೋ ಹಾಗೇ ಇದ್ದೀನಿ. ಅವ್ರ ಮೂವರಿಗೂ ನಾನು ತುಂಬ ಥ್ಯಾಂಕ್ಸ್ ಹೇಳ್ತೀನಿ ಸರ್. ಅವ್ರ ಮೂವರು ಅಷ್ಟು ನನ್ನ ಕೇರಾಗಿ, ಒಬ್ಬ ಫ್ರೆಂಡಾಗಿ ನನಗೆ ಟ್ರೀಟ್ ಮಾಡಿ ತುಂಬ ಕೇರ್ ನೋಡ್ಕೊಳ್ತಾ ಇದ್ದಾರೆ. ಈಗೂ ಅಷ್ಟೇ ಖುಷಿಯಾಗಿದ್ದೀನಿ.
ಸರ್, ನನ್ನ ಹೆಸರು ವಿಜಯ್ ಕುಮಾರ್ ಅಂತ. ನಾನು ಬಂದು ಗುಲ್ಬರ್ಗಾದವನು. ನಾನು ಫಸ್ಟು ಮಹೇಶ್ ಡಾಕ್ಟರ್ಗಿಂತ ಫಸ್ಟ್ ಈ ಸ್ಪರ್ಶ ಆಸ್ಪತ್ರೆಗೆ ನಾನು ಚಿರಋಣಿಯಾಗಿರ್ತೀನಿ. ಯಾಕಂದರೆ ಈ ಸ್ಪರ್ಶ ಆಸ್ಪತ್ರೆಯಿಂದನೇ ನಾನು ಮಹೇಶ್ ಡಾಕ್ಟರ್ ಪರಿಚಯ ಆದರು. ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ಗೋಸ್ಕರ ನನಗೆ ತುಂಬ ಸಹಾಯ ಮಾಡಿದ್ದಾರೆ. ನನ್ನ ತಂದೆ ತಾಯಿಗಿಂತ ಮತ್ತು ನನಗೆ ಫ್ಯಾಮ್ಲಿ ಸಪೋರ್ಟ್ನೂ ಇರಲಿಲ್ಲ. ನನಗೆ ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಟೈಮಲ್ಲಿ ನನಗೆ ಶೆಲ್ಸ್ನೂ ಸಿಕ್ಕಲಾರ ಟೈಮಲ್ಲಿ ನಾನು ಹತ್ಬಿಡ್ತಾಯಿದ್ದೆ ದಿವಸ. ಸರ್, ನನಗೆ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡೋರು ಸಿಗಲಿಲ್ಲ. ಮತ್ತು ತಿರ್ಗಾ ಸರ್ ಹೇಳಿದ್ರು, ಇಲ್ಲ ನೀವು ಏನು ಧೈರ್ಯ ಪಡಬೇಡಿ, ನಾವು ಇದ್ದೀವಿ ನಿಮ್ಮ ಜೊತೆಗೆ ಅಂತ ಆ ಥರ ಒಂದು ಧೈರ್ಯ ಕೊಟ್ಟರು. ಆ ಧೈರ್ಯದಿಂದನೇ ನಾನು ಇವತ್ತಿನ ದಿವಸ ನಿಮ್ಮ ಎದುರುಗಡೆ ಇದ್ದೀನಿ ಸರ್. ಮೇನ್ ಅದು ಇದೆ. ಆಮೇಲೆ ಅದರಲ್ಲಿ ನನಗೆ ಕೋವಿಡ್ 2 ಟೈಮ್ ಆಯಿತು ಅದೇ ಹಾಸ್ಪಿಟ್ಲಲ್ಲೇ. ತಿರ್ಗಾ ಆ ಟೈಮಲ್ಲೂ ಸರ್ ಮತ್ತೆಲ್ಲ ನನಗೆ ತುಂಬ ಧೈರ್ಯ ಕೊಟ್ಟರು. ನಿನಗೇನೂ ಆಗಲ್ಲ, ನೀನು ಚೆನ್ನಾಗಿ ಆಗ್ತೀಯಾ ಅಂತ. ಆನಂದ್ ಸರು, ಸುನಿಲ್ ಸರು, ಮಹೇಶ್ ಸರು ಎಲ್ಲ, ಮತ್ತು ಇನ್ನೊಬ್ಬರು ಮೇಡಮ್ ಇದ್ದರು, ಅವರು ನಮಗೆ ತುಂಬ ಸಹಕಾರ ಕೊಟ್ಟಿದ್ದಾರೆ ಸರ್. ಫಸ್ಟ್ ಆಫ್ ಆಲು ನಾನು ಈ ಸ್ಪರ್ಶ ಆಸ್ಪತ್ರೆಗೆ ಈ ಫೌಂಡರ್ ಯಾರಿದ್ದಾರೋ ಅವರಿಗೆ ನಾನು ಭಾಳ ಧನ್ಯವಾದ ಹೇಳ್ತೀನಿ. ಆಮೇಲೆ ಇದ್ದಿರೋಂಥ ಡಾಕ್ಟರ್ಸ್ಗೆ ಮತ್ತು ಸಿಸ್ಟರ್ಸ್ಗೆ, ಅಲ್ಲಿರೋಂಥ ಎಲ್ಲ ಸ್ಟಾಫ್ಗೆ ನಾನು ಇವತ್ತಿನ ಗಂಟ ಚಿರಋಣಿಯಾಗಿರ್ತೀನಿ. ನಾನು ಯಾಕಂತಂದರೆ ಮಹೇಶ್ ಡಾಕ್ಟ್ರವರು ನನಗೆ ಇನ್ನೊಂದು ಜನ್ಮ ಕೊಟ್ಟಿದ್ದಾರಂತ ನಾನು ನಂಬ್ತೀನಿ. ಯಾಕಂತಂದರೆ ನಾನು ಹೈ ರಿಸ್ಕ್ AML ಪೇಷಂಟ್ ಆಗಿದ್ದ. ನನಗೆ ಯಾವಾಗ ಡೋನರ್ನೂ ಯಾರೂ ಸಿಕ್ಕಿರಲಿಲ್ಲ. ಆಮೇಲೆ ಅವರೇ ಎಲ್ಲ ನನಗೆ ಒಳ್ಳೆ ರೀತಿ ಎಲ್ಲ ಮಾಡಿಕೊಟ್ರು. ಪ್ರತಿಯೊಂದು ದಿವಸನೂ ನಮ್ಮ ಮಕ್ಳ ಬಗ್ಗೆ ವಿಚಾರಿಸ್ತಾಯಿದ್ರು, ನಿಮ್ಮ ಮಕ್ಳು ಏನು ಮಾಡ್ತಾರೆ ಅಂದರೆ ಈ ಥರ ಇರಲಿಲ್ಲ. ಡಾಕ್ಟ್ರ್ ಅಂತಂದರೆ ಬಂದರು, ನೋಡಿದ್ರು, ಹೋದ್ರು, ಆ ಥರ ಇರಲಿಲ್ಲ. ಅಂದರೆ ಈಸೆಲ್ ನಮಗೆ ಏನು ಅಂತಂದರೆ ಒಂದು ಫ್ಯಾಮ್ಲಿ ಥರ ನೋಡ್ತಾಯಿದ್ರು. ಮಕ್ಕಳು ಓದ್ತಾ ಇದ್ದಾರಾ, ಏನು ಮಾಡ್ತಾಯಿದ್ರ, ಚೆನ್ನಾಗಿ ನೀವು ಆಗ್ತೀರಾ ಅಂತ. ಮತ್ತು ನಮ್ಮ ಮಕ್ಳಿಗೆ ಬಂದಾಗ್ಲೂ ಅವ್ರು ಧೈರ್ಯ ಹೇಳ್ತಾರೆ. ಯಾಕಂದರೆ ನಮ್ಮ ವೈಫು ತೀರೋದ್ಮೇಲೆ ನನಗೆ ಯಾರೂ ಸಪೋರ್ಟ್ ಆಗಿರಲಿಲ್ಲ. ನಮ್ಮ ಮಕ್ಕಳು ಆಸ್ಪತ್ರೆಗೆ ಬಂದಾಗೂ ಸರ್ ಹೇಳ್ತಾಯಿದ್ರು, ನಿಮ್ಮ ಪಪ್ಪ ಚೆನ್ನಾಗಿ ಆಗ್ತಾರಾ, ನೀವೇನು ಭಯ ಬೀಳಬೇಡಿ, ನಾವು ಚೆನ್ನಾಗಿ ಮಾಡ್ತೀವಿ ಅಂತ. ಆ ಒಂದು ಧೈರ್ಯ ಮೇಲೆ ನಾನು ಇವತ್ತಿನ ದಿವಸ ಬದುಕಿದ್ದೀನಿ ಸರ್.
ಕ್ಯಾನ್ಸರ್ ಅಂದ್ರೇ ಭಯ ಇರ್ತಿತ್ತು, ಹೇಗಪ್ಪ ಅದ್ರ ಟ್ರೀಟ್ಮೆಂಟ್ ಆ ಥರ ಎಲ್ಲ. ಸೊ ನಾವಿದ್ದಿದ್ದು ಮೈಸೂರಿಂದ ಬ್ಯಾಂಗ್ಳೂರು ಬಂದಾಗ, ಮೈಸೂರಿಂದನೂ ಮಹೇಶ್ ಸರ್ ಹೆಸರು ಹೇಳ್ಕೊಂಡೆ ನಾವು ಬೆಂಗಳೂರಿಗೆ ಬಂದಿದ್ದು. ಸೊ ಮಹೇಶ್ ಸರ್ ಸಿಕ್ಕಿದ ಮೇಲೇ ಒಂದು ಹೋಪ್ ಅಂತ ಬಂದಿದ್ದು ಲೈಫಲ್ಲಿ. ಓಕೆ, ಏನೋ ಒಳ್ಳೇದಾಗುತ್ತೆ ಅಂತ ಅಂದ್ಕೊಂಡು. ಸೊ ಆ ಹೋಪೇ ನಮ್ಮನ್ನ ಇಲ್ಲಿವರೆಗೂ ಕರ್ಕೊಂಡು ಬಂದಿದೆ. ಆ್ಯಂಡ್ ಲೈಫಲ್ಲಿ ಟಿಲ್ ಲಾಸ್ಟ್ ಬ್ರೆತ್ ನನ್ನ ಗ್ರ್ಯಾಟಿಟ್ಯೂಡ್ ಯಾವಾಗಲೂ ಮಹೇಶ್ ಸರ್, ಆನಂದ್ ಸರ್ ಆ್ಯಂಡ್ ಸುನಿಲ್ ಸರ್, ಪೂರ್ಣಿಮಾ ಮ್ಯಾಮ್ ಆ್ಯಂಡ್ ಹೋಲ್ ಟೀಮ್ ನಮ್ಗೆ ಯಾರು BMT ಮಾಡುವಾಗ ಸಪೋರ್ಟ್ ಮಾಡಿದರು ಅವರಿಗೆ ಖಂಡಿತವಾಗ್ಲೂ ನನ್ನ ಗ್ರ್ಯಾಟಿಟ್ಯೂಡ್ ಇದ್ದೇ ಇರುತ್ತೆ. ಆ್ಯಂಡ್ ನನಗೆ ಡಯಾಗ್ನೋಸ್ ಆದಾಗ ಕಂಪ್ಲೀಟ್ಲಿ ಡಿಪೆಂಡೆನ್ಸಿ, ಏನೊಂದಕ್ಕೂ ಡಿಪೆಂಡೆನ್ಸಿ ಆ ಥರ ಇರ್ತಿತ್ತು. ನನಗೆ ಗೊತ್ತಿಲ್ಲದ ಶಕ್ತಿಗಳನ್ನ ಸರ್ರು ನಿನಗಿದೆ, ನೀನು ಸ್ಟ್ರಾಂಗ್ ಇದೆಯಾ, ಆ ಮೋಟಿವೇಶನ್ನ ಯಾವತ್ತಿಗೂ ಮರೆಯೋಕ್ಕಾಗಲ್ಲ. ಆ್ಯಂಡ್ ಆ ಮೋಟಿವೇಶನ್ ಇವತ್ತಿಗೂ ನನ್ನನ್ನು ಮುಂದೆ ಕರ್ಕೊಂಡು ಹೋಗ್ತಾ ಇದೆ. ಆ್ಯಂಡ್ ನಾನು ಇಂಡಿಪೆಂಡೆಂಟ್ ಲೈಫ್ ಲೀಡ್ ಮಾಡ್ತಾಯಿದ್ದೀನಿ, ಹ್ಯಾಪಿ ಆಗಿದ್ದೀನಿ. ಇವತ್ತು ನಾನು ಏನೇ ಖುಷಿಯಾಗಿದ್ದೀನಿ, ನಾನು ಇಂಡಿಪೆಂಡೆಂಟ್ ಲೈಫ್ ಇದೆ ಅಂತಂದರೆ ಆಲ್ವೇಸ್ ಐ ಥ್ಯಾಂಕ್ ಟು ಸರ್.
ನಮ್ಮ ಮಹೇಶ್ ಡಾಕ್ಟ್ರು, ನಮ್ಮ ಆನಂದ್ ಸರು, ಸುನೀಲ್ ಸರು, ಸೊ ಇವರ ಒಂದು ಟ್ರೀಟ್ಮೆಂಟಿಂದ ಇವತ್ತು ನಾನು ಇಲ್ಲಿ ಕೂತಿದ್ದೀನಿ ಅಂದರೆ ಬಿಕಾಸ್ ಆಫ್ ಡಾಕ್ಟರ್ ಮಹೇಶ್ ಸರ್. ಸೊ ಆ್ಯಕ್ಚುಲಿ ಇದೇನಪ್ಪ ಹಿಂಗಾಯಿತು ಅಂತ ಕಂಪ್ಲೀಟ್ಲಿ ಏನು ಮೈಂಡೇ ಬ್ಲ್ಯಾಂಕ್ ಆಗಿಬಿಟ್ಟಿತ್ತು, ಏನೂ ಓಡ್ತಿರಲಿಲ್ಲ. ಇಟ್ ವಾಸ್ ದ ಮಹೇಶ್ ಸರ್ ಆ್ಯಂಡ್ ದ ಟೀಮ್, ದೇ ಯೂಸ್ ಟು ಬೂಸ್ಟ್ ಮೀ ಈಚ್ ಆ್ಯಂಡ್ ಎವ್ರಿ ಡೇ ಆನ್ ಎವ್ರಿ ಮೂಮೆಂಟ್. ಆ್ಯಂಡ್ ಒನ್ ಥಿಂಗ್ ದೇ ಹ್ಯಾಡ್ ಟೋಲ್ಡ್ ಮೀ, accept it. ಹೌದಲ್ಲ, ಐ ಹ್ಯಾವ್ ಟು accept it. ವಾಟ್ ಹ್ಯಾಸ್ ಕಮ್, ಐ ಹ್ಯಾವ್ ಟು accept it. ಆ್ಯಂಡ್ ಲೆಟ್ ಮೀ ಗೋ, ವಾಟ್ ಎವರ್ ಇಟ್ ಕಮ್ಸ್, ಲೆಟ್ ಮೀ ಗೋ, ಲೆಟ್ ಮೀ ಫೇಸ್. ಸೊ ಯಾವಾಗ ಬಂದ್ರೂ ಒಂದು ಸ್ಮೈಲಿಂಗ್ ಫೇಸಲ್ಲಿ, ಇಲ್ಲಮ್ಮ ನೀನು ಚೆನ್ನಾಗಾಗ್ತೀಯಾ, ಡೋಂಟ್ ವರಿ. ಅದು ಒಂದು ಏನಿದೆ ಅಲ್ಲ, ಈಗಲೂ ಕೂಡ ಇಟ್ ಈಸ್ ಕ್ಯೂರಿಂಗ್ ಮೀ. ಸೊ ರಿಯಲಿ ಹಾರ್ಟ್ ಫೆಲ್ಟ್ ಗ್ರ್ಯಾಟಿಟ್ಯೂಡ್ ಟು ದ ಎಂಟೈರ್ ಮಹೇಶ್ ಸರ್ ಆ್ಯಂಡ್ ದ ಟೀಮ್.
ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಸರ್.
ಮಾಡಿದ್ರು ನಿಮ್ಮ ಶಕ್ತಿ
ಸರ್, ಅವ್ರು ಕೊಟ್ಟಿರೋ ಧೈರ್ಯ ಸರ್.